half of the time. As far as parking goes, you can park in the south garage, which is right across from the psych hospital. There is visitor parking. So I think if you park there or in the west garage, you should be okay. If you need help, I can send out my phone number and you can just call me. We'll be meeting at 6:30 in the morning, outside of the front lobby. Report starts at 6:45, so that'll give us a couple minutes to get you some sheets, and to go over kind of the basics, like what deny all mean, what does ABH, all this other good stuff that you probably haven't learned yet. We'll go till about 2:30 because on lots of days I'll be going to work right afterwards, which that'll be a fun time. Am I missing anything, Dr. Langford?
I don't think so. One thing that I would, if at all possible, if there's ECT going on, I'm sure that the students would like to see that if that's a possibility.
I would have to double check with work, but I definitely think I can take a couple at a time to go see it.
Okay.
But there's 3 sessions in the morning. So one at 8, one at 10, and one at noon. So I should be able to take different amounts at different times.
So just to let you got ECT, electroconvulsive therapy, and Vanderbilt is one of the few in Tennessee that actually do it. So that's a great opportunity that you guys have.
And I was just informed that they have to wear N95 masks.
Okay.
Is that a thing?
Do you know if Vanderbilt's going to provide those or if the school needs to provide them? Not sure.
No idea.
Okay, I'll check on it. As you guys can see, new information is rolling in all the time. All right. Thank you, Miss Sadler. Does anybody have any questions for her before she pops off of here?
I do have a quick question. Hello. So you said N95 masks will be required at Vanderbilt for everybody?
Yes. I literally just got that information today. Oh, just for ECT. I'm sorry.
For ECT.
So I'm not sure. Honestly, I've never seen an N95 mask here at the hospital. So I would assume if you could bring one, that would be more beneficial.
I'll see what the school can do as far as providing the masks.
To make sure that all the information in it,
Thank you.
like all these questions are covered by the.
Otherwise, just regular surgical masks are required on the floor.
Okay. Great question.
So I've just been going through finding
Any other
articles,
questions?
because he doesn't say anything about having to use scholarly articles for this assignment. The next assignment we have to, but I don't know about this one.
I read somewhere where it has to be peer reviewed.
Okay, I don't think there's any more questions, Ms. Sadler. Thank you so much for popping in here. I know that you're busy.
Thank you. Look forward to seeing everyone.
Absolutely. I think somebody's mic may still be on. If you could mute that mic.
All right. Bye, everyone.
Bye.
Dr. Langford,
Yes.
I'm so sorry to bug you and interrupt. I noticed on the information you just sent on iLearn that psychiatric assignment list of individuals that has all of our names. My name's not on there.
Is it Morgan?
Yes, Morgan Allen. I apologize. I just emailed you. I'm so sorry. I just wanted to pop
It's
in
all right.
and tell you.
Thanks.
Morgan Allen.
So you're not on the inquiry.
Yes, sir. I
I will
apologize
look-
for interrupting.
Oh, no, not at all. I will look into that.
Oh, it looks like he's up.
Okay. Among my instructors, who else needs to pop on here and talk and then pop off?
Dr. Langford, Jess is on here from CSU.
Who's on here from CSU?
Jess,
Oh,
can you hear me?
yes.
I have a
So-
toddler and a dog in the background squeaking a toy, so we're gonna do what we can. My connection's a little poor too, it says.
That's okay. So everybody, this is Miss Brooks. She's going to be taking you on the regular CSU clinical. And what I'll just turn the floor over to her, let her discuss, anything that she is going to expect from you guys, just her to introduce herself. Miss Brooks has been to CSU, so maybe where to meet her at in the mornings. So with that, I'll turn it over to Miss Brooks.
Are you there?
We are here.
Oh, okay. All the screens kind of cut off for a little bit. Sorry, Matt.
That's all right.
So we'll be also starting at 6:45 is fine. I'll be there at 6:45. So if everybody gets there at that time, that will work. It's just a general short-term psych stay. I'm pretty new to the facility myself. I don't know that there's really a whole lot more to say. We'll start with like a brief introduction. I'll give you your assignments and we'll end with post-conference like any other clinical.
Hey, tell us a little bit about yourself.
Well, I myself have done psych specifically for about 6 years off and on. I've been a nurse for 16 years, also graduated from TTU in 2005. So things are a little different. We all had pen and paper. So all this computer stuff's definitely a newer thing to me, but I think I grasp it okay. I just left a couple weeks ago as a director of nursing at a nursing home because the psych facility that I worked at had closed down due to COVID. So I'm all too familiar with what COVID can do career-wise, but definitely even more so to a patient. So we're also at this point requiring N95 masks. I'll have to ask my supervisor in regards to like, are we supplying or not? And I'll get back with you on that one.
I actually know the answer to that one.
Oh, good.
I talked to him and he says that they have plenty of them.
Okay. I thought so as well.
Yeah. All right. Thank you so much. Does anybody have any questions for Miss Brooks? So on the schedule currently, we have 8 o'clock in the morning for CSU, but I can definitely change that to 7 o'clock.
I'm sorry, I do have a question. Where will we park at CSU? Is there like a specific place we need to go?
Yes. If you go all the way to the very far back, you'll see a sign that says CSU as well as New Leaf, and there'll be a full row of parking just anywhere back there. It's usually pretty obvious. If you're parked against the building, then you're in the wrong spot.
Thank you.
You're welcome.
And I think that if they have difficulty finding the place or getting lost, that they could call you in the morning. You can guide them in.
Yes. Is my number available on their website, or do I need to give it?
It is on the syllabus.
Okay, perfect.
Yep. Everybody's number's on the syllabus.
Texting and calling are both fine.
Anybody else?
I do have a question about what you just said about the time. So instead of 8 o'clock, we will be getting there at approximately like 6:45.
Yep, anytime between 6:45 and 7 is fine.
Okay.
They usually don't start report till 7 o'clock, so.
I would recommend at least 10 minutes early. CSU is one of the facilities that is still screening. So you will have to answer a few questions and then get your temperature taken. So it might take a little bit to get through the line. Anything else, guys?
Dr.
Professor Langford,
Yes.
I'm here and I apologize. I think I pushed record this meeting. I'm trying to get rid of it, but I don't know how exactly.
Oh,
So,
I pushed record it.
did you? Oh,
Yep.
I'm glad it's you and not me. I'm
Yep,
back.
yep.
I'm back.
Yeah, I
Okay.
definitely wanted to record it just in case there's anybody that could not be here at the meeting. The way things are going, it'll probably get corrupted too, but hopefully not. Okay. Okay. If there's
I had
no
a
other,
question, Professor Langford.
yes.
So I'm looking at the clinical schedule and I am in group K. My name is Karina Crook.
Mhm.
And I see that my group, I see like some classmates that are going under CSU. So are they the only ones going to CSU and I'm the only one going to Vanderbilt?
So
Or,
so there's two different CSU clinicals this semester. There's the
okay,
CSU clinical that everybody's going to be going to, and that's with Miss Brooks.
okay,
And then CSU opened up a secondary alternative clinical for those that weren't eligible for Vanderbilt. So if your
okay,
name is not in that box, you are eligible for, as my understanding, you're eligible for Vanderbilt.
okay,
And all of that information is coming to me from Miss McPeak. So I don't know, why people are not eligible or eligible. I'm not privy to that information, and rightly so.
So I'm in the process
okay.
of getting my COVID vaccine for Vanderbilt. So whenever I am fully vaccinated and I send that to Miss McPeak, will that be updated on our clinical?
That's my understanding. Yes. So
Okay, I just wanted to make sure.
yeah. Once somebody becomes eligible, she emails me that information.
Okay, thank you.
And then I can change it. And again, it's not just about the vaccines. There's some insurance stuff, as I understand it. There is, make sure, again, if you are trying to become eligible for Vanderbilt, make sure that you are filling out that TCPS orientation and all of those requirements that are on the UDN. She's going to be looking over that information as well. So all of that will factor in before she emails me.
Okay, thank you.
Absolutely. Yeah. 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 Okay. So
Dr. Langford,
yes.
are we wearing professional dress to clinicals or are we going to be wearing our scrubs?
That's a great question. So, can you save that question until I get through the instructors? Because I don't want them to be waiting on the line if they have to go do something.
Okay, yeah, sorry, that was a little random.
Yeah, no worries. Just ask me that question again if I don't get to it. I believe we had Miss Kimmel. Miss Kimmel, are you still there?
Yes, sir, I'm still here.
All right. So Miss Kimmel is going to be taking those that need an alternative clinical to Vanderbilt, and she will be taking you to CSU. For those that are doing this clinical, it will be a second rotation through CSU. So Miss Kimmel still needs to be oriented to CSU, but it'll be all of the same information that Miss Brooks just gave you guys. Miss Kimmel, were you wanting to keep the same 8 o'clock date?
Yeah, that works.
Or were you wanting to switch to 7 o'clock as well?
It does that, honestly, Dr. Langford, doesn't matter to me. Whichever one works best.
Okay. Since we've already got it there, I'll just keep it the way it is unless, something happens.
Okay.
So Ms. Kimmel, why don't you tell the class a little bit about yourself?
Wow. Well, I graduated from Tech many years ago, it seems like.
I have experience in the emergency room. And for the last 9 years, I have been working in public health with the state of Tennessee. So I've seen a little bit, of everything there. But I always loved mental health in school. So this is going to be a lot of fun.
Thank you. Do we have anybody that has any questions about this specific clinical, or any questions for Ms. Kimmel? I always wait for a minute. Sometimes it takes a while to take your mute off. Okay, I don't hear anything. Ms. Kimmel, thank you so much for jumping on here. And let's see, who else do we have here? Miss Maffitt. So Miss Maffitt is going to be taking you guys to New Leaf for the New Leaf Clinical. It is at the same facility at Plateau Mental Health here in Cookeville. And Miss Maffitt has been teaching this clinical for quite a few semesters now. So I will let her introduce herself to you and give her expectations. You have the floor.
Okay, thank you very much. Hello, everyone. Welcome to the fall semester. I'm looking forward to meeting each of you and working with you. I've gone to Plateau's New Leaf and Detox unit now for several semesters. I'm really enjoying that. My background is in mostly pediatric intensive care, but I also have worked in geriatrics. I have also worked actually at Plateau in capacity in the CSU in the distant past, and I've enjoyed it. It's a wonderful place to go to. We will be going between two buildings. I guess we're meeting at 8, right, Dr. Langford?
Yes.
Starting at 8. I'd ask you to be there if you could 15 minutes before. That way we can find the room where we're going to put your items that you need to study. They usually give us. I'm going to go by and talk with Jamie on Tuesday. Yes. Actually, I may go by and see her this afternoon. She said I could come whenever. But I think they're doing a little bit different with the turnkeys that we get us in the different areas. So, but we work closely with the security guard. We'll spend most of our time in New Leaf, but then we will take a period of time over in the detox area to become familiar with that. A lot of information happens in the morning. It seems that the schedule for the clients works better in that time frame. So we'll try to kind of rotate you out so that everyone can get to talk with their client in the morning, and then people can follow up in the afternoon as we have time. And that's when I usually take you over to the detox area too, if you needed to go. They do have some intakes in the morning. So those that aren't talking with clients, I still need to make sure about are they still wanting us just to have the 6 clients and dividing them, Dr. Langford, into, if there's more, like 6, 3, and 3? Dr. Langford will tell us that. But last semester,
Sorry, I was muted.
That's okay. With COVID, we had to separate them out. And don't worry if you're overdoing paperwork, because you would get to do the intakes over in detox. They're usually in the morning.
Yeah. So for right now, the social distancing is that they try to keep people apart by 3 feet, not 6 feet anymore. But it's no longer required that we split people up. So the whole group can come onto the unit as far as I've been told.
That is wonderful.
Yes.
That will be so, okay, everybody do little jazz hands. Woo! we won't have to be running back and forth between buildings. I was getting my exercise last couple of semesters, I'm just saying. But I will give you time for lunch. We're close to Interstate Drive, so you're more than welcome to go to one of the eating establishments there. I'll give you time to do that. Any paperwork that I've given you, you need to give back to me before you leave the facility, and I'll hand it back to you when you return. Just wear plain clothes, try to, look professional. We don't want you to have holes in your jeans. If you have tattoos and things, they ask you to cover those. I know, like with a nude colored tape or a long, a sleeve or something. Otherwise, I can't think. And good shoes. I mean, not that we'd have to run or anything like that, but you don't want to be wearing flip flops or, shoes
Clogs
without
or
a
anything.
heel on
Yeah.
them.
Yeah.
Yeah. We have had to evacuate the building a couple of times. And if there's someone that's having difficulty, then they will let us know that and we will go to a different area. We've only had to do that once, so no problems there.
Once in how many years?
Just I like the 3 that I've been helping out.
Yeah. So
And it
it doesn't
wasn't a
happen.
bad thing. It was just
It's
the
rare.
person was a bit angry and they said, let's just let you go, and go over to the detox for a little while or something like that.
Yeah. Before I became coordinator, and I say this because I know that this is one of students' usual worst fears is behaviors on a psychiatric unit, somebody becoming violent or something like that, mostly thanks to the media. But it happens very rarely in the places that you guys are attending. In fact, when I was taking students, I took students through clinical for about 6 years before I started coordinating. And over those 6 years, I think that we had to leave the unit maybe twice. So it's a fairly rare occurrence.
Yeah, and it wasn't I didn't think it was that bad, but they did want not things to escalate or whatever. And so we just quietly left. There wasn't any fear factor with it. They told us. So
Right. Yeah. Thank you so much. Do I have any questions for Ms. Maffitt or the clinical? Of course, New Leaf is our substance abuse / detox unit.
I do have one question about our paperwork that you were talking about, Ms. Maffitt. So is that something you'll give us in the morning and we fill out throughout the day and get back
yes,
to the grade?
it's going to be a little different than CSU if you're going to CSU, because they do get a printout, almost like a patient care sheet that you would get in the hospital. We do not get that in Detox and New Leaf. But I am pulling their intake records. You will have a loose leaf record that's in the filing cabinet to see. And the nurse who gives medications has the large MAR, the medication record. They do keep a paper copy, and that's what we look through and find information, seeing how the client did detox, if they had any tremors, if they had any nausea, diaphoresis, any of those types of things. You can see that in those pieces of information. So the paperwork that's for you in iLearn, go ahead and copy that off. I will have extra copies if something gets just misplaced. Once you get on the unit, the very first when we get there, 8 o'clock is when they do their meet and greet and lay out the rules for the day. So that's why I ask you to try to be there 20 or 15 minutes till, and we'll get all of our paperwork out of the way and go over to New Leaf so that we'll be part of that first meeting at 8. And after that, then I will orient you a bit more than I have to the paperwork. I'll show you where the MAR is, where the cabinet is for the loose leaf records. The social worker has given me some paper to look at for you guys so we can understand that a little better. And sometimes they do a group in the afternoon on that. And then, of course, the pieces of work that you need to turn in. Any questions that you have about that, I'll try to answer those before you leave. And we'll give an S-bar to the nurse on your patient so that we can have continuity of care because we're part of the team that day. So I hope that answered your question.
Yes, ma'am. Thank you.
You're welcome.
And if I can cut in real quick, as far as the paperwork, we are going to go over that paperwork in this session since you guys weren't able to view the orientation. So hopefully by the time this session ends, you'll know all about the paperwork.
All right, I'm going to turn my mute myself, okay? You
Thank
guys,
you.
if there's any other questions, let me know. And you can email me too. Thanks.
Thank you. Do we have Miss Preston that's online? I think she was working, but she was going to try to break in. Miss Preston, have you made it on? I don't see her. Miss Preston is going to be taking you guys to Oak Point, which is a geriatric psychiatric unit, also known as Geri Psych. I was going to have her introduce herself, but I don't think she has made it in. And that brings me to my counterpart, Dr. Sarfo. I believe Dr. Sarfo is online here with us. Dr. Sarfo is going to be working with me this semester in 3371 as well as in 3370. He will be teaching half of your lecture. And he is coordinating the accelerated group. So I will turn the mic over to Dr. Sarfo and let him introduce himself.
Okay, can everybody hear me now?
Yes.
Okay. All right, guys. I'm excited to be working with you this fall semester. And as Dr. Lanford mentioned, I'm going to be teaching the second part of the lecture this semester. And I'm not going to take you directly to the clinical rotations, but I might be grading some of your other clinical assignments, like the psych inquiry assignment. And then if need be, any of the other assignments that you may be turning in. And we are going to meet during the sim lab at the College Side Chapel. So I'm excited to meet all of you. And before coming to tech, I worked as a nurse administrator in the state of Georgia Mental Health Hospital for 6 years. And prior to that, I worked on the floor as a staff nurse. So we worked with a different kind of population. We had a lot of behavior issues, and I took clinical students from Augusta University to the same facility, the MSN students. And like Dr. Lanford mentioned, some places you rarely go out because somebody's in a behavior, but over there in Georgia, you encounter behavior issues a lot. But thank God over here, our units are different. I work with the geriatric population. We had 3 forensic units, and behavior is all over the place, either on the geri, forensic units, and all the other units, the acute and long-term units that we had. But over here, I think we are kind of fortunate, but we pray that we don't encounter any active behavior issues that can cause us to panic. So that's about me. And if you have any questions for me, you can shoot me an email. And hopefully we're going to be seeing ourselves during the sim lab shortly. Thank you.
Thank you, Dr. Sarfo. Do I have any questions for Dr. Sarfo specifically?
I did have a quick question regarding the Jerry Psych unit in the clinical schedule. So when I'm looking at it, I see that it's been split. So one group goes from 7 a.m. to 3 p.m. and then the other half goes from 3:30 p.m. to 7 p.m. Is that correct?
Yes, that is exactly correct. Now that unit is requiring only 3 to 4 students on the unit at a time, just like what Miss Maffitt was saying. Both CSU and New Leaf, the past 3 semesters have been requiring that. They no longer require that, but Oak Point still does. And that's why you see that. Mm-hmm.
Okay, thank you so much.
Absolutely. Yeah, yeah. Any other questions for Dr. Sarfo? Hearing none, what I want to do first is say that, I apologize for all the technical issues that's been happening. I've been working with IT to try to resolve them. And at the very beginning, I showed that, the links on my end was working, but it seemed like they weren't working on your end. And I apologize. I know that has to be frustrating. It's frustrating for us that the technology doesn't work when it's supposed to. That being said, I am going to try to do an abbreviated version of the orientation. The actual orientation can take up to 4 hours, so I don't want to keep you guys, and I know you're already fried from med-surg. So I'm going to hit all of the high points that I can. If you have any questions, you can ask me the questions as I'll pause after each section, or just save them up at the end. Or if you don't feel comfortable asking me questions in front of everybody, feel free to email me anytime. All right. So with that, this first page, everybody can still see my screen. Is that correct?
Yes.
Great. So for announcements, make sure that you're checking both 3371 and 3370 at least daily, this front page for announcements, because this is how I and Dr. Sarfo are going to be communicating any thing that happens that's important as far as clinical or as far as the lecture class goes. If you want to look back at an announcement and it seems to have dropped off the board, all you have to go down to the very bottom and hit show all announcements, and it will populate them up. Okay. I just wanted to show that feature to you guys so you know that it's there. So let's start over in content. I'm guessing that you guys have already looked at the syllabus. Let's take a look at the clinical schedule, as this has been a matter of contention. I'm gonna populate up here. There we go. Okay, I had a member of Group B just email me. I don't know, Dominic, are you online?
I don't think he is. He said he had trouble getting the link to work.
Really? Okay, well, I guess it's good I'm recording this guy. So is anybody from Group B online?
Yeah.
Okay, so
I'm sorry.
So with Group B, the question was raised about the alternative CSU. I don't know if you were going to go to that or not, but it was conflicting with CSU and Oak Point. So as you can see, I've moved you guys to November the 1st. And if you go down here to November the 1st, you can see everybody from Group B who needs to do an alternative clinical. I just
So
wanted
is
to
that,
point that
oh, I'm
out, that
sorry.
change out. Go ahead.
I'm so sorry. I was just gonna say that's for the alternative clinic, correct?
That is correct. Yes.
Okay.
So if you see this line here, this line splits for those who need the alternative clinical and those who don't. I didn't want to write everybody's name down unless I had to, because that will just make, you know, everything look busier than it already does. So I tried to make it as concise and as clear as I possibly could. Just recently, within the past day or two, we learned that Vanderbilt will not be letting us start until 9:20, which is why we had to move these groups. Can you guys see the clinical schedule that I'm pointing
Yeah.
out? Okay, good.
Yeah.
So Group D, Group B, and Group F had to be moved to a later time. And again, I've got those highlighted to where you got moved to. So anything that's red or highlighted, pay attention to it, because it is something that is kind of a variant from what the flow of the schedule should be. Okay. If you're looking at the schedule, each one of these columns will represent a week. Okay. And then on this side, each one is the clinical facilities. So you should not find your group in more than one box when you go down this way. Does that make sense? Because that would be in the same week. What I want is that everybody is only having one clinical experience a week in mental health. They have the time to reflect and finish their paperwork before they move on to the next week. And that's my goal. Let's see, what else? We've already talked about having to split up Oak Point, 7 to 3 and 3:30 to 7. I guess let me open up to any questions right now that you guys might have about the clinical schedule. Anything?
I'm sorry, I do have one more quick question.
Absolutely.
So in regards to like going to clinical and things like that, I know for Med-Surg, the night before we go in and pre-plan and things like that, will we be doing any pre-planning for these clinicals, or how will that process look?
It's a fantastic question. Now, whereas Med-Surg, you do lots of pre-planning. So somewhere around 3 o'clock, they will assign you a patient the evening before, correct? You go in, you work up that patient, and then you, which is called pre-planning, and then you go and do your clinical day the next morning. In mental health, it's flip-flopped. So there's no pre-planning, but there is quite a bit of post-planning and reflecting. And that's just the way that psych is. It was psychiatric nursing is more, or at least can be more reflective than Med-Surg. You learn more from the reflection of it.
Okay, thank you so much.
Absolutely. Yeah. Any other questions? We got up here the sim lab. Of course, here's the groups that will be coming into the sim lab at College Side Church of Christ on 8/24 and 8/27. Both of those days will be from 1 to 6 p.m. hopefully we won't be there all the way till 6 p.m. I've cut a few things out of SimLab to try to make it a little bit shorter.
So I do have a question about SimLab. For the presentation,
Yeah.
are we just, so we have to have that done before we get there, right?
Yes, you'll want to have that done. Let's see. I'll go to SimLab. So if you're wondering about any of the clinical sites, any of the SimLab, any of the assignments, you can go to content up here and then run down, and each one of these modules will discuss you know, the clinical sites or the assignment. So going to SimLab, let's take a quick look at these instructions. You guys let me know if you start not being able to see my screen anymore. Occasionally that happens on Zoom. So SimLab is not meant to be a day of worry or strife. It's actually meant to be a day of that you guys have fun with it. So you learn and have fun at the same time. The items that you will need when you come to SimLab at the church is a laptop, comfortable but appropriate clothing, as we will be meditating, and then a pillow. Okay. So if those are your tools of the day, you know it can't be too bad. Down here, this is what we're going to be doing for the first section. So we're going to have several groups that I and Dr. Sarfo respectively are going to be guiding you through. The first group is going to be hand washing. We've added this because Vanderbilt requires us to teach you hand washing. So we've decided to just have a hand washing group and then check you off on hand washing while we're there.
If we completed the Vanderbilt hand washing checkoff in MedSearch today, do we still need to do another checkoff?
Yes.
Okay,
Yes.
I just want to make sure.
Yeah. Because Charla is going to have those for psych and for MedSurg kind of in separate piles. So just to be on the safe side, I would say yes. And then of course we're going to have the getting to know you group, the trust exercise group, the goals group, and the self-awareness group. And then discussion and time for questions if you guys have any questions at the end of that. And I'm not going to go through what all of those groups are. We will do that at SimLab. For the goals group, I do have the group handout that we were going to be using online. If you want to print that out and take it with you, it's not mandatory that you print it out. I will have a laminated copy that we can pass around. But if you want to go ahead and print it out and already be looking at it, that is up to you. All right, let's go back to it. So after we get done with these groups, then we will do our in-person group presentations. So I've already divided you guys up in groups and assigned you a behavioral assignment. You're going to create a brochure with these particular topics. Definition of the behavior. Remember, it's a behavior, not a diagnosis. Okay, so this is how somebody is behaving, not necessarily a mental health diagnosis. So if somebody was diagnosed with major depressive disorder, they might be behaving withdrawn. Does that make sense?
Yes, sir.
So you guys would focus more on withdrawn. You'll talk about which DSM-5 diagnoses you see the behavior in most commonly. And if you want to, you can put more than one diagnosis down. how to assess the patient for this behavior, what would the behavior look like, what is the specific interventions to address the behavior in order of priority. So as a nurse, what specific interventions would you want to do, and in what order would you want to do them in? What is the rationale for the behavior and the nurse's interventions, and how to assess or evaluate the effectiveness of your interventions. So I did interventions, but did it do anything? So how are you going to evaluate? And I will tell you that there is evaluation tools out there. Again, it's not required that you use a tool, but there are tools that you can get an objective number or an objective idea of how well your interventions are working. So that might be something to research when you're doing your brochure. And then after you go through your handout, you will do an oral presentation. You'll go through a short dramatization about your behavior. So one person will be the nurse, the other person will be the client, and you'll act out what you just taught to everybody. Now, if I think some people, there are 3 people in the group. So the third person can be a family member, a peer that might be in the group with you, can be help, that is called, if you needed another nurse. So just be creative with it and have fun with it. I think somebody was about to ask a question.
Yes, I'm sorry. I was actually going to ask about the dramatization. So on that, I've been kind of thinking of how to do it. So say like I'm the nurse and my partner is the patient. So they would be acting in that behavior. For instance, we have like withdrawn and isolated. So they would be, acting in that behavior, and you would kind of like bring it up and be like, hey, I'm noticing a change in you. Has anything happened to make you feel this way? Like different things like that. And then kind of like come to a conflict resolution in the end.
Absolutely. Yep. That's perfect. Mm-hmm.
Awesome. Thank you.
Yeah.
I also have a question.
Yes.
As far as the points under that we're supposed to discuss in our handout, are we supposed to find that within the book, online, both? Because I'm looking and I haven't found a whole lot in the book for my prompt. I'm just kind of stuck, I feel like.
Yeah. If you don't find anything in the book, definitely, and some of these behaviors you might not. So definitely go online, look at some peer-reviewed journals, look at if there's any ANA or APNA documents that you can find about guidelines on these particular behaviors, and you can use those.
Okay, thank you so much.
Absolutely. Yeah. So what I would like to say is when you finish this brochure with your group, you can email this brochure to everyone that you're going to be in group with. Or you can print a hard copy out for everybody that you're going to be in group with. I've had people do one or the other. I've had people do both, although both is not required. Also, I want you to, and this is for all individuals, to take a blank rubric, take a copy of your handout, so both of those, and then submit it into the SimLab Dropbox. So the behavioral assignment right here. So everybody is going to do that, okay? And the reason I have everybody do that is because when you submit something, I have a direct line to you in order to give you feedback. If you don't submit anything in your group, then I don't have an opportunity to give you direct feedback. And that's why I have you guys do that. As far as this assignment goes, I really like you guys to understand why we do assignments. So this is just not busy work. the reason that you're doing this assignment is that before you go into clinical, you're going to be able to see all of these different types of behaviors act out. And your peers are going to tell you through their research on how to deal with all of these different types of behaviors. And of course, I'll be in the room giving my 2 cents as well. So by the end of this group, you will be presented with all of these different behaviors before you even step foot in a facility. And that's the purpose of the assignment. All right. Is there any other questions about SimLab? Now there's one more assignment in SimLab. This is the assignment that I took out of SimLab to try to decrease the amount of time that we're in there, because I know that schedules are really tight for you guys right now. So I made this assignment to where that you can turn it in online. It's due August the 30th, okay? And this is an individual research article assignment. I have already assigned whether you are looking up therapeutic milieu or role of a psychiatric mental health nurse. You will look up a research article, a peer-reviewed article, and hopefully you find one within the last 5 years. And then you'll type up a little summary. And I want you to include the title of the article, the author, the date of the article, a summary of what the article implies or was discovered. Give your impression of what you thought about the article and why you thought it was interesting, if you agree or disagree with its findings. And then APA format citation, so a reference page and then in-text citations where it's needed, okay? And make sure it's a peer-reviewed journal article and not, you know, something pulled out of Psychology Today magazine, because that stuff is not peer-reviewed.
Dr. Langford, is there a like page limit on that? Just because I'm a little long-winded and my article is like super long, so I ended up having like 3 pages.
Sure.
Content.
Sure. There's not a page limit on it. However, I have to read all of them. So
That's true.
I would appreciate, you know, being concise.
Okay.
That's a very good point. I wanted to show you the SimLab assignments because sometimes this gets a bit confusing for people. Okay, so you guys are assigned, like group 1 has suicidal ideation in my group on 8/24. Olivia and Sarah are in that group, okay? Also, this shows you which article you're supposed to look up. Is it therapeutic milieu or the role of psychiatric mental health nurse? If you are a 1, such as Olivia is here, you will be therapeutic milieu. If you are a 2, then you will have the role of psychiatric mental health nurse. And those 2 assignments aren't connected. So you don't have to find the role of psychiatric mental health nurse when it deals with suicidal ideation. Those are 2 different assignments.
I have a question.
Yes.
What if I'm a 3?
If you are a 3, that's what's called a mistake. Where are you?
I'm down there. Keep going. Grace Lawlow.
Grace. Where are you, Grace?
There I am. Oh, I guess I'm a 2 actually.
Okay, yeah, 2. Yeah,
Okay.
sometimes Word will switch people to 3 and I don't recognize it, but I try to switch everybody back. Yep, you're a 2.
Okay, thank you.
Absolutely. Any other questions for SimLab?
So I saw on the instructions that there's a rubric, and is that rubric in iLearn? I was trying to find it the other day and I didn't see it. Maybe I
Sim,
just picked up.
yep, it's the third one down, Sim Behaviors Assignment Rubric.
Okay, thank you.
Absolutely. So yeah, just I won't download it, but just download it, take a look at it. If you have any rubric in any class, make sure that you really know that rubric well, because that is how your instructor is going to be grading you. So it pays to know the rubrics. Any other questions about Simulation Lab? Nope. Okay. So if you can see down here, we have New Leaf, we have CSU, Crisis Stabilization Unit, we have Oak Point, we have Vanderbilt. And if you click on either one of these, so let's click on New Leaf first. In New Leaf, it'll have some clinical rules that are just specific to New Leaf. You have the pre-plan assignment. Now with New Leaf is the only pre-planning that mental health has. And the reason is that substance abuse takes a little bit of orientation before you go on the floor. Now, let's download it real quick. This assignment is due at 8 p.m. the night before you go to the clinical. And basically, you just have to read the chapter in your book and then answer these 9 questions and then turn it in, and Miss Maffitt is going to be grading you on these. If you're like me, you might be afraid that you could forget to do this assignment at 8 p.m. before you go to the clinical, because, you know, I've got a lot of stuff going on. It's okay if you guys want to go ahead and do this now or anytime before you go. The due date is 8 p.m. before you go, but you guys can turn it in at any time before then. Okay. So, and I'm sure that Miss Maffitt would appreciate that as well. And if you look down here, it
Let me
says,
just say my thing didn't unmute. Yes, get that done. Get it done early and I can be looking at them and you don't have to worry. Because sometimes I'm up the night before, just like really kind of late, try to look at them. But anyway, if you don't, I will get up and look at them. Thanks.
Absolutely. So if you look here, it says clinical evaluation tool, daily assessment, and legal ethical assignment. Those are the 3 assignments that you are going to turn in for every clinical that you go to. All right. And if you click on any of these clinicals, you will see daily assessment, evaluation tool, and legal ethical. It will be on every single one of them. Okay. And they're all the same. I just wanted to make sure that they were available to you. So what we're going to do now is look over these assignments. So what I would suggest is taking some notes so that you know how to do this. And again, I'm recording this right now, so you guys could potentially go back and listen to it. But so far, I've not really been having a lot of good luck with IT or technology in this class. So
Can I ask you a quick question?
absolutely.
I just wanted to go back about clinicals real quick. So are we wearing business attire?
Okay, let me go back. Clinical orientation and clinical expectations. Let's do this real quick before we go into and hit this. So as far as dressing expectations, make sure that your hair is pulled back on your head. but not in a ponytail, as ponytails can be pulled or tugged potentially. The bun is always the best as far as working, even in med-surg. Also, you can drag ponytails across some gross stuff and it can become an infection control issue. You don't want any stuff in your hair when you come out of a clinical. Also with jewelry, only one pair of stud earrings in the earlobes, no other types of jewelry. You can wear wedding bands. I would appreciate you not having big diamond type rings that could possibly hurt somebody or could be taken away from you and hurt somebody. Or could possibly get caught on something. Make sure that you don't wear any type of necklaces, of course, because those can become choking hazards. There'll be no lab coats. Did you guys get 3 different name tags when you started this semester?
Just two.
I have 2 from like 2 semesters ago.
Oh, okay. So 2, one of them has your first and last name and one of them only has your first name, right?
Yes.
Okay.
Yes.
So the one that has your first name only, the only reason you have that is for mental health. So that is the one that you are going to wear to every mental health clinical. Make sure that you do not wear the one that has your last name, okay? So the first name only tags. Never wear necklaces, which we talked about. Make sure that you check your scrubs to make sure that they are not too tight. One way that you can do this is to bend over in the mirror. Make sure that you guys do not see your gluteal cleft. So we do not want any potential plumbers in nursing. Be respectful of everyone on the unit, patients, staff, visitors. Do not let anyone in or out of the unit by yourself, please. When you are finished interviewing your clients that you were scheduled for the day, I would appreciate you guys not being in a group. So sometimes when everybody gets done, you guys will start coming together and it looks like a big mob of purple. And staff can sometimes get annoyed with that. And sometimes you have patients who are dealing with paranoia, and seeing people all in a group huddled in uniforms will activate that. So the best way is, once you get finished, you can ask staff if you can do anything else for them. You can talk to other clients, or you can just sit and talk to your client that you've been assigned for the day. Most of the clients are really excited to have nursing students because they can get a bit bored on the unit, and they really like the extra attention. So, but yeah, please don't get together in a group. Remember that you're a guest, so please behave as such. These facilities are allowing us to come in for free for these experiences, and we do not want to take advantage of their generosity. If you're asked to perform a procedure on the unit, please do not go and do the procedure alone. Make sure that you always ask your instructor about that. Now, as far as what you're allowed to do on the unit, you are not allowed to pass any medications in psych. Some facilities will allow you to draw blood if they're doing that at that point in time. Most of the facilities don't do that. Some of the Jerry Psych units will allow you to take vital signs or do a quick head to toe in the morning. Most of psych is an observational or an interview-based clinical. But if a procedure comes up and your instructor is aware about it and can come with you, then take the opportunity. Just make sure that they know and approve it, okay? Again, do not give any psychiatric medications at any of the facilities, but you should always know the drugs just like you were going to be giving them. Do not answer the telephone at any facility. We had to add this one as we've had some students answer the phone and put patients who were suicidal on hold. So it's best for students not to answer the phone at the facility. As far as your personal belongings, things that are valuable, such as your cell phones or your purses, the best way is to lock them up in the trunk of your car. Okay, that way that they are safe and there's no possibility of them being stolen, and they're also not cluttering up any workspace.
I'm sorry, can I ask one more question?
Yeah, absolutely.
So I just wanted to clarify, because I don't know if anybody else has the same question, but Miss Moffat at New Leaf said to wear business attire. So for every other clinical location, we are wearing scrubs.
Yes.
As far as we know. Okay, just wanted to make sure.
So at New Leaf is the only clinical that you can wear business attire. All of the other clinical sites are scrubs. Absolutely.
Okay, thank you.
And it's just like nice khakis, you know, a nice shirt, not things that are ragtag, but, you know, just kind of looking professional. You don't have to be in like major business wear. Not that you all ever look ragtag. You're very spiffy. Everywhere I've gone with students, everyone's like, they're awesome.
Thank you. Yes, ma'am.
Okay.
I'm looking a bit ragtag myself today. Let's
Okay,
see.
me too. Call us out. I walked the dog. I got wet. Anyway, I'm enjoying this last couple of days of, you know. All right, I'm going to cover myself up again.
No, you're fine. Thank you. Okay. Cell phones. Oh, yeah. I was also going to say what I would suggest is so that we don't clutter up the unit. If you guys want to bring reference material, I would suggest you designating somebody in the group bringing one copy. So one person in the group bringing a copy of their DSM-5, one person in the group bringing a copy of the textbook if you think you need it, and so on and so forth, so that you guys only have one copy of the reference material and not a whole bunch of them.
Dr. Langford.
Yes.
Are we allowed to wear our watches? Just curious.
There's no need to wear the watches.
Okay, just making sure.
Mm-hmm. COVID-19 expectations have changed just a little bit. Be prepared to wear face coverings in clinical unless told otherwise by your instructor, which I do not think you will be told otherwise. Most of the clinical sites continue to require social distancing of 3 to 6 feet. I am not sure how strict they're going to be on that. But that is what most of the unit directors have been telling me. Some facilities, especially Plateau, continue to screen and temp check. So both New Leaf and CSU, you might want to come in like 10 minutes early to make sure that you get through the screening and still have time for the pre-conference. If you're feeling ill, especially that you have any known symptoms of SARS-CoV-2, please call or text your instructor that day about it, and then call or text me about the situation. And then we will try to work out some kind of alternative for the clinical. All right. We definitely don't want to spread the virus any more than it already has been. We're all crossing our fingers that we continue to be able to do these clinicals in person. I believe the hospital director of Tennessee just came out yesterday and said all of the ICU beds were full in Tennessee. So things are ramping up again just a bit.
I have a question.
Yes.
I'm sorry if you've already answered this, but for the clinical schedule that you just posted, the yellow and the purple thing, what does it mean if our name is under, like it says CSU and then our name? Does that mean we go there and then the rest of our group goes to Vanderbilt? Or
Is this under the Vanderbilt block?
it says Vanderbilt Alternative Clinical at CSU, and then
Yes.
there's a couple names.
Yes. So above it should be Vanderbilt, and it says the group, right? And the day that they are going to Vanderbilt. The ones that are below that says CSU, and then it has your names. Those are the people that, as far as I have been told, are not eligible for Vanderbilt. So I've placed you into that alternative clinical on Fridays at CSU. Now that's different than the regular CSU clinical that you're going to be going to. Okay. That's just an alternative for Vanderbilt.
Okay. And I have one more question. I'm so sorry.
No, you're fine.
So I noticed when I tried to watch the orientation,
Yeah.
when I try to refer to the two videos that were split in two parts, it told me to download Microsoft Edge and I had to pay for it. And
no,
so
I wouldn't pay for it.
Would it be sufficient to watch the old video and then just kind of rewatch this recording?
Absolutely, if you can. People have been telling me that they can't watch the old video either. And that's why I'm going through all of this right now.
Perfect.
But I've had so much IT stuff for
it's okay.
For whatever reason.
We'll get through it.
Yeah. So those links are working on my end, and the old video is working on my end. But for some reason, you guys are having trouble opening it, and IT cannot tell me why. So we are getting through it. Absolutely. Okay. So this is the clinical evaluation. This is going to be the longest part of what you turn in. Okay, so please take notes on how to fill this out. What I would do is download one clinical evaluation and have it be your master that you're going to be turning it in. You're going to sign your name. You can do it electronically, is fine. And then when you get finished at the end of the semester, you will have all of these filled out. Does that make sense? So when you go to New Leaf, you fill it out. You go to Oak Point and fill it out. And once you're done with all of them, they'll all be filled out. And this is the one that you're turning in each time. Does that make sense, guys?
Yes.
Okay, great. So under points, this is how much each bullet point or number is worth. And I'm going to go through these numbers one at a time and tell you the expectations. So the first one demonstrates understanding of patient's diagnosis, psych, and substance abuse using DSM-5 site criteria of your patient's diagnosis. Highlight the criteria the patient exhibited or exhibits to support diagnosis and provide subjective and objective data from patient to support the criteria. So that's a long explanation. What I'm looking for and what your instructors will be looking for is when you go on the unit and you get the chance to look at the chart, you will pick out one psychiatric diagnosis that your client has. And then when you go home, you're going to look up this diagnosis in the DSM. And let's say it's major depressive disorder. So major depressive disorder. And under major depressive disorder, you'll see 9 different criteria. So you'll put in all 9 criteria, 1, 2, 3, and so on. And then you will highlight the criteria that your client met when you were there. So you can observe this criteria, something that you saw. You can hear this criteria from the nursing staff, or you can read about this criteria in the patient's chart. All 3 of those types of data will work for you being able to say that they had that particular criteria, okay? And then below your highlighted, once you highlight the criteria, you'll go down below it, and then you'll type in how you know they met that criteria. Okay, does that make sense to you guys so far?
Yes.
Okay.
Can you put this on this specific sheet right here?
Absolutely.
Okay.
And all of it will go on this sheet. Yep. And then after you get finished with all of that, you will make sure that you reference the DSM-5, okay? So do an in-text reference to the DSM-5, and then come down here, and you'll make a reference page here. My spelling is off. Make a reference page there and do a reference citation, okay? Once you do that and you're continuing to use this document, after you do it the first time, you won't have to do it again because you'll already have referenced it, if that makes sense. Not all of these are that difficult. So the next one, number 2, is able to answer questions and process information with minimal prompting. For this, your instructors are going to be taking you into post-conference. You're going to be talking about your patient. You're going to be giving them a report about your patient, and they'll probably be asking you questions. Now, if they ask you a question and you got stumped, or you think that you could have answered the question a little bit more full, what I want you to do is write down that question while you're in post-conference. When you get back home, you'll type what that question was and how you should have more fully answered the question. And you can go ahead and look it up. And we have a raised hand. I'll get you in just a second, Ms. Maffitt. So you can look the question up and answer it a bit more fully. And then if points were going to be taken away from you because of that, those points should be added back. All right. And I'm going to ask Miss Maffitt to speak up on what she had raised her hand about.
Yeah, I did. On the DSM for New Leaf and Detox, you said any diagnosis, but in that area specifically, are you wanting them to learn about their addiction? Would you like them to do the diagnoses that were there when they came in to detox, or the secondaries that might be moving up?
It would be more beneficial to, in that clinical, do a substance abuse diagnosis, I would think.
That's what I thought. I just wanted to clarify that with the student. So when you come to the detox and New Leaf area, like I said, I'll be sending you that intake record, and it will have their DSM that they were admitted with. We'll talk with the counselor if we need to, or the nurse, to make sure that we get that initial diagnosis for you to use. Thanks.
Yeah, thank you. The next one is demonstrates understanding of medications. So what you're going to do is you're going to pick out 2 medications that your patient has for that day. One of those medications has to be a psych med. And the second medication can be, but doesn't have to be. Okay. The reason I make that rule is because sometimes there's only one psych med that's on the chart. So you'll choose your 2 medications. And of course, you can consult with your instructor to see if, these medications might be good for looking up. When you go back home, you'll look up these medications and you're going to use what's called the medication tool. You should be able to find this on all of the clinical sites. So since we're doing New Leaf right now, we'll open up New Leaf, and there you see medication tool. We'll download it. So for both medications, you're going to answer all of these questions. So you'll answer all of these questions for your first medication, and then you'll go back and answer all of these questions for your second medication. But this is just a tool. You do not turn the medication form itself in. You answer the questions within the evaluation document. Does that make sense to everybody?
Yes.
Okay. Okay. And then after you answer those medication questions, you will skip a space, and then you'll tell your instructor whether your 2 medications interact with each other or not. All right. And that's it for that bullet point. The second one, approach interaction and communication with the patient is appropriate, site-specific communication techniques utilized. You guys on Monday are going to have me lecture about communication and communication techniques. So this part will make a little bit more sense after that. However, what I want you to do is when you come back, you will look up specific communication techniques that you used that day with your client. So it's okay if you need to pull up that communications PowerPoint and look back through all of the different communication techniques and what their definition is. But I want you to state the specific names of the communication techniques that you used and how you use them with your client. Okay. And then if you noted any barriers to communication that you did, you can also note those. And we'll talk about both facilitators and barriers to communication Monday. The next one uses the nursing process, so assessment, nursing diagnosis, planning, intervention, evaluation, to identify and address signs and symptoms of psych and substance abuse. This data should only be collected from your interview. So this first one where we're talking about, you can use the chart, you can use what other nurses are telling you in report. You can only use in this particular bullet point, you can only use what you collect in your specific observations, okay, for that day. And I know that your instructors will appreciate if you bullet point these things. So you type in A for assessment, or you can type out assessment, and then you put in the specific findings of the assessment that you found. And then B for, and then maybe ND for nursing diagnosis, and what your nursing diagnosis would be based on those assessments. And then your plan or your goals, what your plan or goals would be, and so on and so forth. Does that make sense to you guys? I think I have Alyssa with a raised hand on this. Go ahead, Alyssa.
I was just curious because this is a lot of like information we're gonna have to put on this. Are we gonna be able to like carry around our clipboards to like take notes on?
Fantastic. Yes, absolutely. And what I
Okay,
would suggest, and what I would suggest you do is printing off a copy of your evaluation, your assessment, and taking that with you.
Okay,
so that
great.
you can take notes on it.
Thank you.
Absolutely. Yeah. Okay. Any other questions on this particular one? Okay. Next, identify psychosocial issues that may require a community referral during hospitalization. Now, this is going to be a little bit different based on what site you're going to. The main idea is that clients are given what they need in order to be successful and not fall out of remission, whether that be remission in substance abuse, substance use disorders, or remission with mental health illness. So in New Leaf, and Ms. Maffitt can correct me if I'm wrong, I think that she's probably looking for if they are referred to some AA-NA program, or if they have a good plan to remain sober, and what that plan is.
Yes, and we will, like I said, social work person has given me a list of what the clients go through. It's just like in hospital situation where you have inpatient. They are actually looking toward discharge, and like Dr. Langford said, we want them to be successful. The piece with these people is that they're following through on the plan. They have all the resources there, but then they are the ones that are going to follow through. But I'll be showing you that, and have I actually put together little I've stapled together several helps that I give you during your downtime when you're looking at stuff. So if you have any questions after I talk about that, and when you're interviewing your client, perhaps because they're there of their own volition going through this program to learn all of these skills, maybe you'll glean some information about what their idea after discharge is. And many of them know that if they're closer to discharge. Some that aren't, your goals might be that they continue to go, to the meetings. Just that's something that they want them to do. Go to all 5 meetings during the day, and talk with their counselor, once a day, and different things like that.
Yeah, absolutely. Yeah. And then that'll change in CSU. You might be looking for, if they're getting out, are they going to need medication management as far as their psychiatric medication? Are they going to need therapy referrals? Are they going to need some community referrals for support or further support? Make sure that you ask your instructor what they're specifically looking for, but that's the main ideas in this particular bullet point. First one under professional communication, communicate significant changes to the primary nurse immediately. And what was the follow-up action? So if you see anything with your client that changes from, they have a headache to they get agitated and throw a chair down the hall, and anything in between, hopefully the latter won't happen. But if you see any of those changes, you should go talk to your instructor first, and then you and your instructor will find the nurse who has your client for that day. And you'll give a report on this change in condition. And I want you to note what that staff member, what that nurse is going to do to help resolve that issue. Okay. Now, this is clinical, so sometimes nothing significant happens. And in those cases, if nothing significant happens at all with your client, then you can state that. No significant issues happened with my client today, no significant changes. But if something would have happened, then I would have contacted my instructor and the client's nurse for that day, something to that effect. Are you guys good with that one?
Yes.
Okay. All right. Next one, provide end of shift report in an SBAR format. You guys should be familiar with SBAR. I think several classes use SBAR besides us at Tennessee Tech. So again, I'm sure that your instructors would appreciate you putting it in, S bullet points, tell what their situation is. Of course, their situation is kind of what happened, why they are specifically there. Then your background is going to be histories. So a lot of the times you'll find your background in the chart unless they talk about their history during your interview. So it's okay to use chart information here. And some of the histories that you may find is medication history. You can find health history, so medical diagnoses. So don't forget that people who have psychiatric, mental health illnesses, substance use illnesses also have medical illnesses sometimes. So you can include those. Do they have high blood pressure? Or do they have diabetes? Those would be important to include in your background information. You can also include social history. Do they have good social support? Those kinds of things. Next would be assessment. Of course, that is your assessment that you did today. So I would not put everything, especially if they're normals, but if you find abnormals that you really want to talk about, I would place them under assessment here. Okay. Another thing that you're going to place here specifically is your objective tool for the day. The objective tool. Your objective tool will probably have some kind of number once you get home and add everything up. And then it'll have instructions on what that number means for the client's health. With each specific facility, Vanderbilt, CSU, New Leaf, so on and so forth, you will have a different objective tool that you're taking. And those can be downloaded from each module. So if you see here, New Leaf, you have CWA and CALS tool. You're going to be taking both of those with you to talk with your patient about, to assess them with those tools. CSU, where are you? You're going to have the PHQ-9 tool that you're going to download and take with you. For Vanderbilt, you're going to have the AIMS tool. And those that are not going to Vanderbilt and are going for a second CSU, you will also take the AIMS tool with you, okay, for that clinical. Does that make sense, guys? Want to make sure that you guys are following along. Yeah. Okay. Okay. So that is where you will be putting your objective tool that you assess, and then recommendations are. So situation, background, and assessment is all different kinds of data. You're going to look through that data, and if you have to, you can circle it and find what major problems is going on with the client that you want to try to take care of, and then list those problems under here, and then tell us for each problem what you want to do about that. Okay. And that is there. Next one is participates on the unit as a member of the team. This is all about group. So with each clinical that you go to, you're going to be in participate in a group at some point in time. Of course, the groups differ depending on what facility you're at. You're going to talk about, with this bullet point, what the group was about, how you participated if you did, and if there was any significant thing that happened during the group that day. And then this one, documentation is thorough and concise. I think this one is everybody's favorite because it's kind of like writing your name and getting points for it. So all you have to do is type in C assessment. And that's it. Since you guys have typed in your assessment twice already, and then you will do so again for the daily assessment, I don't see a reason to do it again. So type in C assessment and you get that 5 points. That's all you have to do there. All right. And then finally, we have two more. Demonstrates responsibility and accountability for practice and acknowledges errors in judgment. This is strengths for one and areas of improvement for the other. So under strengths for this one, I want you to tell your instructor things that you're proud of that day, that you were proud that you did. You feel like it was an accomplishment with your client. And go a little bit further, I want you to look up a JCO behavioral safety goal, an APNA standard of practice, an ANA code of ethics, and I want you to attach it to that. Why are we having you do that? You guys have heard about evidence-based practice, right? Well, that's what that is. So you guys are telling us, I am doing evidence-based practice, and here is my proof that I've done evidence-based practice. Now, if you want to look for any of these things, there are links in your syllabus to every single one of those, and we'll take a look at that in just a moment, okay? And then, of course, reference this with in-text citations, and then the reference page at the bottom in APA format. The next one is acknowledges errors in judgment. We can all do better every single day. So you guys should not be typing in, I had no errors today, or there's nothing that I could improve on. We can all improve. So find out what you could have improved on. If it's multiple things, then it's multiple things. And go further and tell your instructor a goal for your improvement, and then what you're going to do to reach that goal as you go further into clinicals. All right. Now, if you come down here, you'll see strengths and weaknesses. Well, we've already done that. So I do not care if you guys copy and paste strengths and areas of improvements in those sections. And I don't think that any of the instructors do either. If you do, speak up now or forever hold your peace. I hear nothing. Okay, guys, any questions?
One more time, because something happened when I touched my screen. What did you say?
I
Fill it
said
in this part right here.
I said for areas of improvement and strengths, I don't mind if they copy and paste those into the bottom section.
No, I usually tell them that because it's duplicated a little bit.
Yeah.
All right, thanks.
Absolutely. Any questions about the clinical evaluation? This is the largest assignment.
I have a quick question about it. Is there like a example on iLearn that we can like use for future reference, or is it just the blank sheet?
There is not a reference currently. I will try to look and see if I can find one from another student. Just remember that, it might not be perfect.
Hey, Dr. Langford.
Yes.
On her question, while you've been saying all of this, I've been typing almost exactly what you've said, and I think I'm going to send this out to everyone. Like, for example, like with the critical thinking, I put exactly what you need to do and like sourcing the book. And so I've been trying to keep up with that. That may be a helpful example
That would be more helpful than me posting something that somebody else did.
You are definitely an angel. Your classmates will adore you.
Yes, I'm trying to do my best on it. So make sure I'm
Absolutely.
including as much
You-
information as I can.
Did you get elected class president?
I did.
Oh, there we go.
Yes.
I see why.
Yes, so I'll make sure to send that out to the group me and everything.
Awesome. Any
Thank
other
you,
questions?
Harvey.
Any other questions on this? Nada? All right. Now let's look at the assessment. So the daily assessment, again, I would print this off and take it with you with every clinical that you go to. You'll put your name up here, not the client's name, of course. You will never put the client's name on any document that you turn in or that you take off of the unit. No identifying marks of any client that you are given for the day. What this is kind of a basic watered down mental status exam. Now we're going to go over the true mental status exam in class, but for this one, this has some of the basic parts that you would need to know and that you're going to assess your client for that day. So let's take the first one, speech. If your client is kind of stuttering, then I would circle it that day. But when you go home, you will highlight it on a fresh copy, and then you will come down here and you will tell your instructor what you saw to make you think that they were stuttering, okay? If the client was appropriate, you highlight appropriate, and then you tell them why you think that they were appropriate. Now, I always say that telling people how they are normal or appropriate is always harder than describing a disorder that you see. What I would always suggest is explaining that there is no alterations to what you would consider baseline. So for speech, the three things that you are looking for is tone, rate, and volume when they're speaking. So right here, you would say, I see no issues with tone, rate, or volume. Tone, rate, and volume appeared appropriate. Patient appropriate of tone, rate, and volume. Any variation of that would work, okay? Appearance would be the same. You're looking for poor hygiene. Were they clean? Was their hair disheveled? Did they look like they had shaved in a while? Did they have an odor that you could perceive under bizarre? I've had clients that have wore their underwear on the outside of their pants. That's a bit bizarre, or having a feather boa, or wearing a whole lot of clothing and a huge coat when it's in the, really hot on the unit. So any of that stuff would be considered bizarre. And then just tell your instructor again why you are choosing what you're choosing. And the reason why you are saying you're describing why you are choosing each one of them is because I want each instructor to be able to agree with you. So just paint a picture with words on why it is that you chose what you chose so that your instructor can agree with you, or that they can maybe correct you. I think it probably would be better if you checked this instead of that. Under psychomotor, you'll see tremor with a space beside of it. The space denotes whether the tremors are fine or gross. Okay, so just as a rule of thumb, tremors that are gross, it crosses the line when it starts affecting their gait. And that would be gross tremors. ADLs should be self-explanatory. Activities, are they going to groups? Are they doing the activities during the day as they're supposed to? Suicide and violence risk. You will be asking your patient or your client that day, have you been thinking about harming yourself or anyone else? And that covers suicide and violence risk, both. Hopefully the answer is no. If the answer is yes, you should probably get your instructor and the nurse to come evaluate that further. Okay. Fall risk, is the client at risk for falls? And then a hint in the New Leaf direction, if they are currently on detox protocols, receiving medications that make them a bit woozy, they become automatically fall risks because of those issues. Elopement risks, this does not mean that they are going off and getting married. Elopement means that they're at risk for leaving against medical advice. And if that is the case, one way to assess that is to just ask them, are you thinking about leaving the unit before you're discharged? Or you could just assess. You can see if they are wringing their hands a lot, if they're checking the doors, if they're watching people leaving the doors in and out. In some units, it's not as big of a problem because it's not really locked. I think New Leaf might be one of those.
Oh, I was going to say one nice way to validate that for me is because they all go outside at one point or another during the day. And if they come back in voluntarily and don't run for the woods, they're not elopement risk. Because what if they do go outside?
Yes, yeah. And that would be good criteria to put down here. The client did not run into the woods during smoke break. That would be good criteria. Orientation, I think you guys have done that in physical assessment, so that's pretty straightforward. Under thought content, we're going to look down here. Again, we're going to talk about all of this in detail in lecture, but just to give you a broad look at it, hallucinations and delusions are very different. They're both types of psychosis, but hallucinations deal with sensory, where a delusion is a fixed false belief. So if they see something, hear something, feel something, or smell something, olfactory, that is not there in reality, then that is a hallucination. Now, if they just believe something to be true, but there's no sensory involved, then that is a delusion. And sometimes it can be both. So you have to be careful with that. You can have paranoid delusions, grandiose delusions, which means that they think that they are great, or they have some kind of special ability. Religiosity, they may introduce themselves as God or Jesus Christ. And then other, we've never had anybody have to use the other under delusion, but it might be interesting if you have to. Any questions so far before I get into the thought process?
Yes, I had one. So
Okay.
while we're doing our daily assessment, we don't have to do it all in one sitting, right? Like we can observe them throughout our clinical day. Like, yes,
Absolutely.
we can ask them, if they have thoughts of harming themselves or others, but stuff like
Yeah.
gait,
Yeah.
we can observe that. right?
Absolutely. Yes. Yeah. Yeah. Obviously, you're not going to ask them how they're
Yeah.
walking.
Yeah.
Yeah. Definitely. And then again, this is an observational clinical.
Okay. Yes.
When you are a nurse out on the mental health floor, you are going to be filling out a mental status exam once a day, usually, so that those will vary, and you may have a range throughout the day. So yeah, definitely. Any other questions about things so far?
Can I interject really quick? When you're
Oh,
assessing in the New Leaf and Detox, you've already had assessment, so make sure to look at people's arms for tracking, cutting, tattoos, bruising, whatever. I mean, you'll be able to see those things. We're not going to do a physical assessment on them there. It's all observation.
450. I don't know. So thought process. Let's look at it. It's probably one of the more difficult ones, but I will give you a little bit about what each one of them means, and then we'll hit it in more detail during lecture. So let's start with circumstantial. Circumstantial is a lot of erroneous detail. You asked a question, and then they start from when they were an infant and give you their entire life story to answer the question. So that is circumstantial. Eventually they'll answer the question, but it may take a long time. Then tangential is kind of what it sounds like. It is the client going off on tangents. So you may be talking with them, and then all of a sudden they'll switch gears, and you can still follow them, but they noticeably switch topics, and they might do that frequently. Then we have loose associations. Loose associations is where the transitions start breaking down. So you start having trouble recognizing the transitions within their thought process. They start jumping from one to another in a manner that you are having trouble keeping up with. Their associations with things are very loose. We hit flight of ideas, which flight of ideas is kind of loose associations on steroids. They may start talking really fast like this, and their thoughts are flying off into the sky. You most likely will not be able to keep up or hold a really good conversation with clients that are at that level. And then word salad is where it kind of all breaks down. They start talking to you, and it is complete gibberish. All of the words are out of alignment, and the sentences do not make sense. It would be like taking words from a page, pouring it into a bottle, shaking it up, and pouring them back out. It just doesn't make any sense whatsoever. And then let's come back up here to concrete. So concrete, you would think kind of is a good thing, right? They were thinking concrete and logical. Well, in actuality, concrete means that they are not able to think abstractly. They think very concretely, and they can't think outside of the box. So if you were to ask somebody one of those childhood riddles, so a bird in the hand is worth two in the bush, what does that mean? Your client may say, I don't bird hunt. So they think really concretely and have trouble going abstractly at all. And that was kind of quick, but any questions about those? I know we may have some people writing them down. I don't mind going back over it if you need me to. Okay, I don't hear anything. I'm going to move on to mood and affect. These are right beside each other, and that's for a reason. They play off each other. So mood is exactly what the patient says their mood is. How do you feel today? I feel good. The patient feels, and the best would be euthymic, and I'll explain that in a moment. And then you would write down under evidence an exact quote. The patient states, and then I feel good. Or just in quotes, I feel good, noting that it's an exact quote. That would be what you would be looking for. Now, as far as affect is your interpretation of what their mood is. And it can be their body language, it can be their tone, the way they're saying things. So then you would assess how you believe or how they look like their mood is. And what you're looking for is a congruence between the two. If they're smiling and saying, I feel really depressed today, there's something going on there that you're going to have to investigate a little further. That is incongruent. Euthymic right here is the baseline or normal of mood. Now, euthymia only deals with mood, so you can't say that they have a euthymic speech. It's an appropriate speech. Euthymia is only the normal when it deals with mood. Of course, irritable, depressed. Euphoric would be kind of through the roof, excited. They just did a line of cocaine. Agitated. Labile. Labile means that they may be smiling and laughing with you, and in about 30 minutes, they're crying for really no reason that you can tell. And then, of course, anxious. I think everybody understands anxiety. Under affect, incongruent would be incongruent with mood. Labile, we talked about. Flat or constricted. If we have any Walking Dead fans in here, flat or constricted would kind of look like Eugene. They would look like this. And there's not a whole lot of excitement going on in their face, but they're going to talk like this. And the level of excitement or mood just seems flat. Blunted is not flat, but it's headed in that direction. The mood or emotions do not reach a level where you would consider it baseline. And then bright would again be, very happy, so exuberant. And then we go to Erikson. Erikson's model is a developmental model. It has, I believe, 8 stages in it. And if you do not remember Erikson's model from Psych 101, I have posted an Erikson's module for you guys to look at. This is a video explaining the 8 stages of the Erikson model. And then this is a Erikson summary chart that you can print out and take it with you on the unit. All right. So you will figure out, try to figure out which stage of development that your client is currently in. And you will tell us why you think that, and then give a quick blurb to a reference on Erikson. Now, it can be a peer-reviewed journal. We would rather it be something peer-reviewed that gives a better understanding of where your client is at, and then cite that and create a reference page at the bottom for Erikson. And then under physical, if you guys passed last semester, then you should not have any problem with this. This is not really a head-to-toe assessment. This is more of a review of systems where you're asking about their body systems. So under neuro, you would ask any headaches, do they have lightheadedness or dizziness, any numbness in their fingers or toes, any of that stuff, and then go on to cardiac, any chest pain, have they been having any chest pain, irregular pulse, palpitations. And I want to direct your attention to here again, it's a daily assessment. So it would be if they are having these things today, okay? Under respiratory, you have a line here by cough. This is to denote if they have a dry cough, or a wet cough or a productive cough. And then sputum, what color is it if they're getting any sputum up? How many hours of sleep are they getting, or do they think they're getting? And then under GI, you'll see another line under bowel movement. Yes, you do have to ask your client if they have pooped today. And if they haven't pooped today, you'll want to know when the last time they pooped was. And then you will document when the last time they had a bowel movement. And then I think the rest is pretty self-explanatory. You got pain down here. And then finally, you have the note. So all through this, you have been writing why you picked what you picked. So there's no need to go into a huge explanation on the narrative. You should put the date and time of the assessment. And then if you have mostly normals, then you can put patient had appropriate speech, was appropriate of appearance, were at activities, no SI or HI, no fall risks. I don't care if it is, complete sentences, as long as you get the information down in a concise manner. And then at the end, you're talking about the abnormals that you find and giving a little bit more detail about the abnormals. And then you will sign your name and then that you're a student nurse for your credentials. Okay, so with this, just think about if you were a nurse on a shift and you had 8 patients and you were given all of these papers for a report, how much would you want to read to take care of your patient for the next 12 hours? And that's what mind frame you should be in when you're writing the concise narrative at the bottom. And I think maybe Miss Maffitt is cutting in.
I just want to ask one really quick question. Like with the pain part there, whenever you're talking with the client, instead of just saying, "Are you having any pain?" If they say no, well, I like to get like on a numerical, just say, give me the rate of what your pain is, with 0, no pain at all, up to 10 being the worst you'd ever want to feel. Because a lot of times persons, as you're going through this assessment, forget, because that's their normal and it is maybe a constant something. But anyway, that's just one thing I'd say. I don't know what you think about that, Dr. Langford. I just
Absolutely.
Different, because I want to see a 0 pain rating now. If they say, no, I don't have any pain, then say, just rate it on a 0 to 10 scale. With 0 is no pain, 10's the most. Go ahead and put a 0.
And sometimes on your unit, the pain can be a little bit exaggerated at times.
Yeah.
So it's okay to write objective, that they were saying that they were at 11 on a 10 scale, but then your subjective is that they were not looking at that particular pain level, that they were laughing and smiling at jokes and talking to other clients.
Yeah.
So
Thank you.
Absolutely. Thank you. Do I have any questions about the daily assessment? Okay, so moving on. The third one that you're going to turn in, go back to New Leaf, is the legal ethical, and this is by far the most, the shortest. So for every clinical day, while you're there, you're going to be looking for a legal or ethical issue on the unit. So some of the more common ones that you might see, errors in the chart, whether it be misspellings or things that are actually untrue compared to other parts of the chart. You might see where they have medical information of the client where they can see whether it's on a board or whether somebody's leaving a clipboard down. If somebody is talking about somebody's medical history, private healthcare information in front of other people or within earshot of other people. Some of those are some of the more common ones that you might see while you're on the clinical. You'd write a short blurb of what you would see, either legal or ethical, and then you would go into the ANA Code of Ethics, which I'll show you where those links are here in just a moment, and you would link that to the nurse or whatever staff member should have been more cognizant about this particular ANA Code of Ethics in treating the client. So this should be maybe a paragraph, maybe 2 paragraphs at the most. Okay. Now, when you turn these in, say you're going to New Leaf, you can come down here when you check New Leaf to the assignment drop-down boxes, and here are all the boxes to turn it in for New Leaf. Or you can go under the assignments, and here are all the assignments drop boxes for the class. Okay. Now, the one difference in turning things in would be the Vanderbilt/CSU clinical alternative. There is no legal ethical paper that you have to turn in for this clinical. But other than that, all of them are the same throughout all 4 clinical experiences, and they are all due Sunday by 11:59 of the week that you went to the clinical. Okay. And the one variation in that is the week of 12/7. You have to turn it in before the last day of class. And unfortunately, we had to utilize that week. We didn't have a choice, but you won't have until Sunday. You'll have to turn it in before the last day of the semester. Okay. And I don't think that affects everybody, but it does affect a few people. So let me download the syllabus real quick, show you where those links are. So here are everybody's phone numbers. If you need to contact them, you get lost or some kind of illness might happen, that is how you would contact your instructors. And here are all the links. Now, I've checked all of these links before this class opened, but sometimes links will become corrupted or will break. So if any of these break, please let me know, okay? And I will repair them. And then you will have an AANA community reflection journal that is due by the end of the semester. So you and another person will go to an AA or NA meeting, and this can be anywhere between now and the end of the semester. And you will attend a meeting. Usually the meetings are in the evenings. No more than 2 students at a AA or NA meeting, because we don't want to overwhelm the group. And then experience what an AA or NA meeting is like. Then you will come back home and you'll download this community experience assignment. And you will follow these instructions and write a reflection of what you experienced that day. And I would suggest you write it within 24 hours of attending one of these, so that it's still fresh on your mind. Okay. Down here, community meetings. Here is AA or NA meetings in the Cookeville area, which is where we are. We have Celebrate Recovery, which is a Christian-centered recovery program that is hosted at College Side. We have AA meetings in Crossville, if you are closer to that side. And then these are Al-Anon meetings. Now, Al-Anon meetings are meetings for the family members of those that have members of their family who deal with substance abuse, not people who specifically deal with substance abuse themselves. And this is the first time that we've added Al-Anon on here. So if any of you guys are interested in seeing that side, you're more than welcome to attend those meetings as well. Do I have any questions about the AA or NA community meetings?
Now, would it be okay if we went to an AA or NA meeting in Nashville instead of the Cookeville area?
Absolutely. Yeah. Yeah. These are just suggestions that I have put out here to help you. But if you don't live in this area, then yeah, definitely.
Okay, thank you.
And I have talked to all of these facilities. They are expecting students. And usually are very welcoming of students. One of my favorite things to grade are these papers, because it really seems like the light bulb kind of comes on for people, like, you know. And remember that usually in AA and NA meetings, these are sacred spaces. These meetings are what is keeping them healthy and away from disease. Just, and I've never had any reports of anybody being disruptive. I just want to make sure that you guys know that, and to treat it with respect. Yeah, I know. We had a person from Al-Anon contact us, and we thought that would be a great idea, a great opportunity. Okay, so another thing that you guys might want to take a quick peek at is the clinical makeup assignment. If one of you guys gets sick during the clinicals, or for some other reason not able to do your clinicals, there is an assignment that is already built in that will count for all 8 hours of that particular clinical. So I won't go over it. It's just if you guys need that, then we can go over it together as needed. And then last but not least, I want to go over the psychiatric assignment. So the psychiatric inquiry assignment is kind of the capstone for psychiatry, mental health. This is the culmination of everything that you're going to learn this semester. You're going to have a due date of your group meeting with an instructor, and it'll be either meeting with me or meeting with Dr. Sarfo. and that is by November the 8th. And then this is due by November the 22nd. Okay. And let's take a quick peek at these instructions. So your group, and I believe usually it's groups of 4 people, can take these instructions and divide up all of the work between the 4 of you. And what you're going to be doing is creating a client's chart and a manuscript based off of 3 different things that I'm going to be giving you. And when you're creating these charts, you can use these instructions as the template. In fact, I suggest that you use them. All you have to do is to delete the instructions. Here's your chief complaint. And all of this is instructions about what to do with your chief complaint. You can delete all of that and then just type the chief complaint as it would show up in a chart. History of present illness. This gives you some guidance on that section. Just delete all of the guidance and then type in your history of present illness, and so on and so forth. Now, as we get closer to the date, if you guys have any questions about it, you can always email me or Dr. Sarfo. Let's see. What I would do is download the client list. And also download the group list and put them side by side. Okay, so for group 1, we have Kaylee, Dominic, Elizabeth, Marley, and Hannah, and their instructor will be Dr. Sarfo. If you come over here to the client list, number 1 is a psychiatric client. They have auditory or visual or both. You have a psychiatric emergency, meaning violence and in need of a physical restraint. And then you have 3 medical/psychiatric problems. The client has epilepsy and has been a standing order for Haldol, so on and so forth. A granulocytosis diagnosis, and it is not clear what the hallucinations are or why. I can't see the rest of the screen, but you guys will take the emergency and these 3 medical or psychiatric problems, and you will create a patient's chart interweaving what would the labs look like with somebody with these problems, what would somebody's history look like, and so on and so forth. Does that make sense, guys?
Yes.
Okay, so you're in, and I've had people ask, are you completely making it up? Absolutely. You are completely making up a client's chart, but the trick is it has to have these pieces throughout. Now, once you get done with the chart, what is the manuscript? The whole purpose of the manuscript is to tell the grader how you are interweaving all of these things throughout the chart. Okay, that is one of the points of the manuscript, so that we can pretty much figure out, yeah, that's correct, but sometimes you guys throw in some sneakiness, and I definitely want you guys to get credit for that. So really explain to us what you were doing. The second point of the manuscript is you guys, as long as COVID doesn't shut us down again, are going to represent a psychiatric mental health hospital in the Senior 2 hospital simulation. Now, what that means is the Senior 2s have to run a mock hospital during Dead Week. And their job is to make up the management, to be the nurses, and to just pretty much run the hospital. They have ICU, they have post-op, I think they have surgery now. They have just the ICU floor, they have just the regular floor. They have an emergency department, and our class will be making up the psychiatric floor. And your clients will be making up the clients that the Senior 2 students will be evaluating. And at some point during the semester, I want one of you guys to choose 1 or 2 people, depending on how you write your manuscripts up, to act as the patient at the end of the semester. So you will be acting out your client, and you will be seeing if you can trick these Senior 2 students. It's been a while since they've had mental health. So throw in some tricks in there. The chart does not have to be completely accurate. The chart can have inaccuracies in them. Like, for instance, you can put that they are allergic to a medication, but it shows up in their medication list. And in the manuscript, just let us know that you know that's in there, and you did that in order to see if you can trip up these Senior 2 students. All right. Does that make sense, guys?
Yes.
All right. I like seeing these clients come to life. We haven't been able to see it in the past. Oh, no. I lost my iLearn. We haven't been able to see it in the past 3 semesters because we keep getting shut down. All right, guys, let me get this pulled up again. Throw out any questions that you have for me while I'm trying to get my screen back on, if you have any. Nothing? Okay. Now, I did not go over the orientation PowerPoints. Where is it? So I will leave that to you guys. What I would suggest is to start with Snow Day here, Fall 21, and let that PowerPoint guide you throughout the rest of the orientation of anything that I may have missed. I don't think I've missed anything, but if I have, and you guys see that when you look through the PowerPoints, please let me know about it, and I would love the opportunity to clarify anything that you guys need. All right. I will be continue working with IT to try to get the video orientation up and going, but unfortunately, no promises. I will also be posting this video. And if you have trouble with this Zoom video, again, let me know.
I think that a lot of people missed out that didn't join because this felt like an orientation more than like a question
and answer. Well, it was meant to be a question and answer, but kind of turned out to be an orientation because of all the problems that we had, unfortunately.
No, it's very helpful though. Thank you.
Absolutely. Absolutely. Well, if there is no more questions, I am going to end this session. Thank you for everybody who came. And if you run into anybody who did not make it to this orientation, let them know that I will be posting this video under clinical orientation in the content, as well as making an announcement about it. Okay?
Yes.
Thank you.
Thanks.
Absolutely, guys. I will see you Monday.
Thank you. See you
Yes,
Monday.
sir.
All right. Bye.